Hello and welcome to another episode of Health and Wellness, Save a Life. I'm Gargi Rawat. The problem of sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices. When medical emergencies like cardiac arrest happen around a person, it's important to be prepared. If you are aware and informed, then you can take steps to revive a person and save a life. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR. We're joined by Dr. Girish Kale, interventional cardiologist, Hriday Sparsh Multi-Speciality Hospital, Nashik; Dr. Kalpesh Hansora, interventional cardiologist, Sal Hospital and Medical Research, Ahmedabad; Dr. Kaushal Gandhi, consultant interventional cardiologist, Pulse Cardiac Institute, Anand. Thank you so much, doctors, for joining us on the program. Dr. Kale, the healthy lifestyle we should lead has taken a back seat. It has harmed us today, and with incessant heart problems, what are preventive tests for the heart?
Yes, routine heart health screenings are a very important part of preventive health care for adults. Because of increasing young population getting affected by the heart attacks, starting at around age 20, now we advise many tests. AHA, that is American Heart Association, advise tests like serum cholesterol, blood glucose level, blood pressure measurement, and HSCRP. This is a blood test to detect heart problems. If any abnormality is detected by this test, then further testing like ECG, 2D echocardiography, treadmill testing, and angiography, either CT coronary angiography or catheter angiography, has to be advised to the patient to detect heart problems.
All right, Dr. Hansora, we have heard about electrocardiogram, that's the ECG, EKG test. What is it and what are the heart conditions that can be determined by an EKG?
Yes, so cardiologists commonly prescribe the electrocardiograph. It's the ECG. It's a simple and easily available test. The ECG, that means the electrical signals which is coming from the heart to the surface, which will record, and it determines the many cardiac condition. So it is simply harmless test which is available in next door of your hospital and houses. So ECG is useful to determine or detect any arrhythmias or any coronary artery disease. That means whether you are having a minor heart attack or major heart attack, or even it is useful to detect any previous heart attack. So when you are having symptoms and signs like chest pain, shortness of breath, breathing problems, palpitations, all kind of the loss of consciousness, I advise you have to seek the medical advice, and the first and foremost test you have to carry out is electrocardiogram.
All right, Dr. Gandhi, what is coronary angiography? Who should consider a coronary angiography?
Good morning all. To visualize the blood vessels of the heart, we perform coronary angiography. There are three vessels in the heart: LAD, left anterior descending artery; LCX, left circumflex artery; and RCA, right coronary artery. By injecting a dye into a sheath, we take a sheath from right radial root, right, and we introduce a catheter. And by injecting the dye, we visualize the blood vessels of the heart. We see if there is any stenosis or not, right? And by doing the angiography, we advise the patient to go for angioplasty, which is known as the introduction of the stent, which is known as challa in Hindi, or we ask the patient to go for bypass surgery. The commonly patients who comes to our OPD, each and every patient, and we don't prescribe the patient to go for coronary angiography directly. For example, any patient, he or she 60 years of age, patient is having a diabetes, uncontrolled diabetes or uncontrolled hypertension, patient have any kind of tobacco chewing or smoking. This kind of patient, if ECG shows the sign and symptoms of myocardial infarction or heart attack, in this kind of patient, we ask the patient to go for coronary angiography. And according to angiography, we advise the patient to go for angioplasty or bypass surgery.
All right, Dr. Kale, many wearable gadgets, smartwatches, and there are even phone applications that claim to detect heart problems. Can these gadgets detect heart problems? What's the reality?
Yes, some newer generation smartwatches can detect blood pressure as well as heart rate. Uh, but these gadgets cannot detect heart attack. For detecting heart attack, we have to get a 12 lead ECG and some blood tests to confirm it. And again, we have to do 2D echocardiogram. Yes, but these devices are very much important for risk assessment as well as for monitoring the patient's treatment part. And some devices are there, like they are just 4 or 5 inches ECG machines now are available that can detect your real time ECG either single lead or in 6 leads. So definitely there are some hindrances, some technical issues or some accuracy issues are there, but definitely in future these devices will be very helpful for monitoring the patient healthcare regarding heart health.
Dr. Hansora, what is the normal heart rate? How much heart rate fluctuations is normal for a person?
Yes. So normal heart rate is between 60 to 100 beats per minute. So because heart rate is keep fluctuated each and every time, because why this adaptation is necessary when you are doing strenuous exercise, when you are climbing the stair, at that time body has to adapt with the heart rate. So heart rate adapts according to your need for the body. So fluctuation in heart rate, it is a normal phenomena. In some condition, there may be increase in heart rate, like if you are anxious, so your heart rate will be higher side. If you are having a fever infection, sometimes the heart rate will be higher side. Suppose in resting condition, when you are relaxing or sleeping, that time heart rate is goes down. So this fluctuation is a common phenomena, but it is also helpful when you are having so much fluctuation in heart rate. Like if you are having some condition like arrhythmias, when it goes beyond the 110, 120, that time it's necessary to the early detection of this heart rate rhythm disturbance, which when will you decrease the risk of the sudden cardiac arrest, as we are discussing about the save a life. So this fluctuation of rest is normal phenomena when you are having a nothing. But if you are having any symptoms like a palpitations, if you are having a loss of consciousness, if you are having any breathing problems, that time heart rhythm disturbance can detected early and you can have a further treatment to save your life.
Right. Dr. Gandhi, if you could tell us which heart conditions can cause sudden cardiac death and can we prevent sudden cardiac death?
Yes, there are many conditions which can cause the sudden cardiac arrest. What is the sudden cardiac arrest? In front of you, patient collapses on a bus stand or bystander to you. Patient having a massive myocardial infarction, which is known as heart attack, or many congenital diseases, or a patient having any genetic abnormalities, or a patient may have HOCM, which is known as hypertrophic cardiomyopathy with obstruction. For example, patient having a young individual who is a footballer or heavy exercises during the gym, patient may have succumbed to a cardiac arrest and death. Right. For example, another kind of patient who have ischemic attack and patient have heavy exercises during the gym and patient is already on any illicit drug, for example, steroids or anything. Patient having the smoker, that kind of patient having a massive myocardial infarction, massive heart attack, and this patient have a sudden cardiac arrest. So this is the important chapter, and Stanley India is the one who initiated this process. And to prevent the sudden cardiac arrest, we should learn the CPR, which is known as cardiopulmonary resuscitation. What is the CPR? There are 30 chest compression and 2 mouth-to-mouth breathing. Up till the 108 ambulance or any ambulance comes to you. Right. So if you are a bystander of any patient who have collapsing in front of you, you should start a panic button by phone call and you should do a CPR. CPR is the simple technique, 30 chest compression, learn the CPR cardiopulmonary resuscitation, by which we can prevent many patients who having a sudden cardiac arrest, any young individual or any aged patient having a massive heart attack.
All right, Dr. Kale, during cardiac arrest, what happens to a person? If you could explain to our viewers exactly what is cardiac arrest.
See, in simple words, cardiac arrest means stopping of the heart. What happens? Suddenly, patient's heart stops working. There is heart cannot pump. There is no circulation of blood to the lungs as well as brain and other organs like kidney and peripheries. So, our brain can sustain loss of blood for up to 4 minutes. It can sustain, but not more than 4 minutes. During these 4 minutes, we have to start cardiopulmonary resuscitation in the form of cardiac massage. And cardiac massage mimics the pumping of the heart artificially. So it will provide blood to the brain and as well as heart and kidney, so that advanced heart support we can get till that time, and the chances of survival of patient will increase if we can support the patient at least for 5-10 minutes with the CPR. CPR can be continued as long as advanced support is available. Till up to 30 minutes we can give the CPR. So cardiac arrest means as good as near death, but we can prolong with the CPR.
All right. Well, we have a lot more questions for the doctors, but for the moment, we'll slip into a short break and return with more. Stay with us. Welcome back. You're watching Health and Wellness, and we're talking about heart health. Dr. Hansora, if not treated immediately, sudden cardiac arrest can lead to death. How can CPR help with sudden cardiac arrest?
Yes. So already Dr. Kale and Dr. Gandhi has said about the need for the CPR. So patients who is suffering from the sudden cardiac arrest, if you not intervene within 6 minutes, this patient going to die. So he'll have a sudden death. So it is necessary to intervene the all patients who is having a sudden cardiac death. So this CPR is the first aid process or first aid to patients revived who is suffering from the sudden cardiac death. Meanwhile, you can call the emergency number for the advanced life support. The CPR is a basically basic life support in which you have to compress the chest, as already discussed by Dr. Kale and Dr. Gandhi. So chest compression, actually it is replacing your heartbeat. So chest compression, if you are doing only chest compression without breathing, then you have to give at least 100 chest compressions per minute to maintain the brain circulation as well as the systemic circulations. Meanwhile, the ambulance or other medical persons arrives and he can start the basic life support and advanced life support. So it is the first aid process to revive any patient who is not breathing or who is having a loss of consciousness.
All right. Now, Dr. Gandhi, if you could tell us what precautions should existing heart patients take while traveling?
Okay, during the traveling, if we go to India or outside India, we should have the prescription what the drugs are prescribed by the doctors and the physician or cardiologist. For example, any patient should have a kit including a aspirin tablet or incosprin tablet plus any other antiplatelet blood thinners, for example, clopidogrel or ticagrelor or statins. And patient should carry a drug which is known as sorbitol, sublingual sorbitol. So patient should have a prescription which strategy which the procedure was done in the past. For example, the patient undergone the stents or bypass surgery, right? What the heart functions at that time. Patient should have all the records in PDF format or by the physical format, and patient should carry a kit with him, including a aspirin, any other blood thinners or statin therapy and sorbitol sublingually, right? So another kind of patient, for example, patient should go to high altitude places. Patient should have an ECG and echo done before the high altitude places. For example, patient having a pacemaker implantation previously. So there is a card initiated by the company, and patient should carry that card. And if the patient undergoes the any scanner machine, if it is MRI compatible pacemaker or MRI non-compatible pacemaker, so this all can be precaution by which patient should carry with him. For example, patient is going to abroad or patient is within the India. Right?
Right, Dr. Kale, can a person recover from heart disease and how long does a person live after a heart attack?
Yes. Once you have been diagnosed with a heart problem, it cannot be cured completely, but with the proper treatment and medication, you can be healthy as good as other persons. Once you get heart attack, it will take around 2 weeks to 3 months to recover fully. We have to adopt a healthy lifestyle. We have to change our diet. We have to do regular exercise. We have to, if patient is smoking, he has to quit the smoking, moderation of alcohol consumption, and he has to take care of his stress. That he should not get these precipitating factors again and again, and he will be free from the disease. Also, coming to the medicines, he has to take his medicines very regularly and do follow-ups with the cardiologist or physician on regular basis, and at least 1 yearly he has to do the preventive test like 2D echocardiogram, treadmill test, blood cholesterol level, blood sugar, and if if you follow these correct lifestyle changes, medications, and other lifestyle changes, patient can live a healthy life and live long.
All right, Dr. Hansora, if you could tell viewers what is angioplasty and what is the stent for?
So as we have discussed how to prevent the sudden cardiac death, so angioplasty is a primary treatment to prevent sudden cardiac arrest and sudden cardiac death. There is two terminology we use cardiologists. One is angiogram or angiography, and second is angioplasty. So angiography is the only test which is diagnostic test, as Dr. Gandhi has mentioned about the procedure. What we do, it's just for diagnosis of the disease. Angioplasty means you are treating the blockage vessel to improve the circulation of the blood to the heart muscles. So commonly we perform two types of angioplasty. One is elective, means patient who is having a stable without any ongoing chest pain, breathing problem. This is the elective angioplasty. And patient who suffered from massive heart attack, in those patients we perform the primary or emergency angioplasty. So emergency angioplasty has shown the too much benefit in prevention of the sudden cardiac death in patients who suffered from the massive heart attack. So actually angioplasty is a opening of the narrowed or blocked vessel by putting the stent. Now what is stent? Stent is just a wire which is knitted and mesh up, and it is drug coated. So its work is to expand the blocked artery. So angioplasty is a very effective treatment for the prevention of the sudden cardiac death, and stent is used to open up the blocked artery, and in further it will prevent the even second episode of the sudden cardiac arrest.
Right. Dr. Kale, if we're talking about, stent, if you could, tell us a bit more about that. Does a stent rust in the body since it's made of steel? These are some of the questions, the viewers have. And what are the chances of the stent then getting blocked again after an angioplasty?
Yes, stent is a metal mesh. It doesn't get rust in the body, but it gets like internalized into the coronary artery very soon, like within a period of 3 months. Internal coating happens to the stent and it gets internalized to the artery. But yes, sometimes the stent can get blocked if the patient doesn't take these antiplatelet blood thinning medications. He has to take very regularly. There are many blood thinners like clopidogrel, prasugrel, and newer generations like ticagrelor. But if patient doesn't take them regularly and doesn't follow the healthy lifestyle changes like reduction in the saturated fat levels. That is, he has to eat healthy oil, he has to do regular exercise, and he has to do follow-ups very regularly. And some initial stents like bare metal stents, they used to get obstructed or blocked, but now these newer generation stents, they are very thin strut with the polymer coating and a good drug coating over that. So these there are very less chances, I can say less than 1% chances these stents getting blocked in the patient nowadays. And these newer drugs are very potent, so very less chances of getting blocked these stents.
Okay, so that's good to know. Dr. Hansora, if you could tell us about exercise, since that's been something that's been in focus about, the way to exercise and what exercises are healthy. So for a patient who has had a heart attack, what kind of exercises should they follow?
So whenever patients having a coronary artery disease means heart problems, we always recommend doing exercise. There are some protocols when patients having already either underwent for coronary angioplasty or patients who is having a stable blockage, we advise to do exercise at least 30 to 45 minutes in a day, up to 5 days of the week or all 7 days. And preferably exercise, he is supposed to do that aerobic exercise, because weightlifting, it should be avoided, because ultimately when you are doing weightlifting, you are giving stress or strain to the heart muscles. So aerobic exercise like jogging, cycling, running, and at least walking 45 minutes or 3 kilometers in a day, that will sufficient to maintain the adequate blood flow inside the coronary blood vessels. Not only that, if you do the regular exercise, it will help the formation of collaterals. Collaterals means the small vessel will help you when you will get the another heart attack or massive heart attack. So exercise is a necessary and important component of the heart problem.
All right. Well, thank you so much, doctors, for taking time out and answering all our questions to create awareness about heart health. Thank you all for watching at home. Goodbye.